Yeah, well, being a female surgeon, I'm a little bit have disclosures, as I said, to talk about this topic. But yeah, I think it was quite. I don't know. Was it difficult? I'm not quite sure. I had the vision. I wanted to be a surgeon. And my father sometimes said, he is a surgeon, he said, no, perhaps eye or something else, but not surgery. And, you cannot come home, complications, you always have to look for your patients and so on. But I said, no, I want to be a surgeon. And this was true. And therefore, I got all the possibilities to get more informed, to get more skilled. I was on courses. I used all the possibilities to skill myself, because sometimes it's not so easy, even not for men, to get the access to surgery. We are there, we care for patients, but you do not come to the OR. There's no operation for you being young. And this is, you being young means you are 25, you are 26, 27, and you want to do something and they say, oh, well, you're too young. Huh? So this is something difficult, but it's not only for women difficult, it's also difficult for men. But then you have the possibility, you can go to have skill courses, you can join ESSO courses, for instance, which is wonderful society for young people, especially. You have the fellowships and all these things where you can go. It is tremendous society for surgical oncology. And then by a sudden you also learn that surgery is a big thing to do. You can have bone, upper, lower, endocrine, a lot of things, not all oncology. But then you learn that you can behave and you can give the patients who are with cancer, you can give them something, not only your skills, but also empathy, patience. You can help them to overcome the information. You get peritoneal metastasis or something, but we can do something. But first of all, now you have to go and then come back. And if you have questions, you always can come back. All these things is important for a patient who gets the information, you have cancer. You think what that could mean for the patient? Patient says, oh, well, I do not now belong anymore to a normal environment. I am out of the environment. I'm cancer patient. I have no future. So I have to step back. What will my family say? I have just kids, 2 years old. I will not see them grow up. All these things comes to a patient if he gets the information, I have cancer. And this is also difficult for us. I was in some hospitals where this, yes, yeah, the oncologist will help you. Bye-bye. Yeah, because they are also not able to stick to this topic. It is difficult to talk to patients who have cancer. They have a lot of questions, you cannot answer them. But perhaps you can make them more smooth and give them hope, and try to find ways to give them a little bit more than just the word cancer. And this was making me traveling through my career. And then I had the possibility to also ask me the question, am I good enough? And therefore I started courses and invited all the experts from Europe, and they come. And then you say, oh, well, yes, I can do this too. And then you also get in these cloud of experts, and by sudden yourself, you're an expert. That's it, what it is. Yeah.